Hi, students, and welcome to Procedural Coding Week 4. So this week we're going to discuss a little bit about the musculoskeletal system. When you're starting to code this type of system, the first thing you're going to look for is your body type, or that's the first thing that you code is the body type. And then you code the general type of procedure, and then any individual codes to describe each of the specific procedures that are being performed or that were performed. So the CPT codes are for the musculoskeletal system are 20005 through 20999. And these are some of the types of procedures that you may see. One is a bone biopsy, the application of fixation device, bone graft, replantation of body part, wound exploration, and arthrocentesis. So we're going to look at a few of the rules for coding fractures and dislocations because this can sometimes be the most confusing. So first of all, you want to answer some questions from the chart. So what body type is involved? Was the fracture dislocation treatment open or closed or with percutaneous skeletal fixation? And then was the fracture dislocation manipulated? So I want to be clear about the differences between the diagnosis of a closed and open fracture and then the treatment of closed and open fractures. So for a closed fracture, the diagnosis is when the bone breaks, but there is no puncture or open wound. And then in an open fracture is one in which the bone breaks through the skin. Okay, so that defines the open part of it. And then for the treatment, closed treatment refers to the treatment of a fracture or dislocation without a surgical incision into the site. The doctor basically manipulates the fragments without surgery. And then with an open treatment, the fracture or dislocation that includes exposing the site via any surgical incision or when a fractured bone is open remote from the fracture site to insert a nail or a nail across the fracture site. So the fracture is not open or visualized in this particular case. And then we have the percutaneous skeletal fixation, which is the treatment of a fracture by placing fixation devices such as pins across the fracture site. And this is usually done with under an X-ray imaging. And so with the percutaneous fixations, you can sometimes see that on the outside of the patient's body. So next we're going to look a little bit at ICD-10, and the chapter for musculoskeletal and connective tissues is chapter 13. So it's not just the chapter 13 in your book, just to make sure I'm not confusing you. So it includes the anatomic specificity and laterality of the condition being classified. So I have a couple of examples here. And so arthritis of the right hip due to staphylococcal infection. Here the right hip is the laterality, and then the staphylococcal specifically describes the infection. And then with the age-related osteoporosis with current pathological fracture of the right humerus, age-related describes the osteoporosis or makes it more specific. And then, of course, the right humerus defines the laterality of the bone. So I just kind of listed a few of the chapter 13 categories of the codes that you'll see when you're coding the musculoskeleton. There's many more, but I just wanted you to kind of get an idea of how you have the codes and then the types of diseases that can kind of help you know where you need to go based on your documentation. So that's just a snapshot of that there. And then coding guidelines and instruction notes for ICD-10 chapter 13. When you first go to chapter 13, you're going to see the following note: using external cause code, following the code of the musculoskeletal condition, identify the cause of the musculoskeletal condition. So these are just things to help you to know, okay, I need to look for this in my documentation. So for example, with M00 through M02, there's an instructional note that has the definitions for direct and indirect infections. And so, for an example, a direct infection of the joint or an indirect infection of the joint. That's more documentation that you need to look for in order to be specific with your code. And that's what specificness is required in ICD-10. And then instructional notes are added to different categories or subcategories to explain how codes should be assigned. So it's just another tool just to remind you of what else you need to look for in regard to the documentation to be as specific as possible. Well, I hope you've enjoyed that. I hope it's been helpful. And again, if you need any assistance or have any questions, please reach out to me. Thank you.